Hope, a story about hope. Once upon a time in the Tiny Bud's kingdom, there was a story full of hope. Our tiny hero you'll get to know. Flip the page and off we go! It was a bright and sunny day when the wind blew 3 tiny seeds into a patch of land to stay. They woke up when they landed. They were excited to be planted. They could feel the rich soil below their new home where they would grow.
Cozy!
The 3 tiny seeds started to giggle. As they giggled, they started to wiggle. They wiggled down into the soft, warm soil. 1 seed, then 2, then 3.
1, 2, 3!
Dreaming of the big, strong tree they hoped to be. It was nice and cozy under the ground. For the first time, they could stretch their tiny arms and roots around. They quickly fell asleep that night, only to wake up with a fright. A loud sound was heard above and about, and the first seed was curious to find out. Although it felt scared, tiny, and weak, it bravely poked its tiny head up to take a peek. Rain and thunder filled the sky. A very strong gush of wind swept by.
It's so
They heard
cold!
the first seed cry. The other 2 seeds felt afraid and yelled out.
Come back under the soil!
You can hear them shout.
Wait after the rain has gone away. Stay here. We're dry and warm this way.
But the first tiny seed decided to stay. It kept its head above the soil all day. And when the storm stopped and went away, there on its head, a bud grew to stay. But it wasn't the end of our tiny seed's troubles. Oops, a rabbit hopped on its head while avoiding some puddles.
Oh, it hurts!
The first seed cried. The other 2 seeds worried and sighed. They said,
Please stop growing. Come back before it's too late. Please quit exploring. We will all have to wait.
But the first seed did not stop. It straightened its bud and stood up.
I can do this!
The first tiny seed said.
I will not give up!
Now it wasn't long till the sun started to shine, but the ground became dry. The first seed didn't feel fine.
Oh, it's too hot up here. I can feel the sun right on my head. Why don't you stay with us where it's cooler instead?
The other 2 seeds said. Below the ground, the 2 seeds were scared. They only knew the comfy home they shared, and they couldn't understand why. The first tiny seed wanted to try and try and try. But after some time passed, the first seed came to know that rain brings water fast and sun brings warmth and glow. The first seed discovered that both of these helps it grow. It was no longer afraid, and the taller it grew, even animals became friends. They smile when they pass
Howdy,
through.
little seed.
Every day it reached out to the sky. With the help of rain, sun, and soil, it grew, stretching its leaves up high. It even saw a rainbow. What a beautiful view.
Ooh, it's so wonderful out here. The world is so new. I can't believe my eyes.
It said to the 2 it would tell them stories from above the ground and about every single wonderful thing around. Finally, 2 other seeds decided to leave their fears behind. Out of the ground they grew, each one strong, brave, and kind.
Strong, brave, kind. Call me Tiny the Bud.
The first tiny seed said.
Because of the tiny bud on my head.
Tiny inspired more seeds to grow. Does not matter how fast or how slow. From these 3 seeds of hope, more tiny buds came. They filled the land. No 2 are exactly the same. This is the story of how they became and how the Tiny Bud's kingdom got its name. Some days when we feel scared, hope will guide us through. Tiny buds will be here, growing with you.
mommy buds, daddy buds, and of course, if there are tiny buddies watching as well, hello to everybody. I am so happy that you guys are here with us today, and of course, our partners, My Pedia Network. Okay, nakikita ko sa comment section that we have a lot of parents watching na very excited, and let me tell you guys, ako rin very excited and sobrang thankful, sobrang grateful na we were able to put this together with our partners today. So before we start things off, today of course we are with My Pedia Network, but this is also a Tiny Remedies live. So ano yung Tiny Remedies? If you guys are not familiar, Tiny Remedies is the collection of parang first aid items that you guys need for any tiny worry. Alam nyo na, as parents, napakahirap naman talaga. Hindi natin alam kailan magkakaroon ng sugat or bigla na lang makakagat ng lamok or kung ano-ano man, diba? So, for any tiny worry, meron dyang tiny remedy na handa for you guys. So, they have also partnered with My Pedia Network to bring you this very informative and very important topic. Today, we are talking about the new Omicron variant and how it's affecting kids, and most importantly, giving you parents a guide on what to do when you encounter it. So kung hindi kayo familiar kung sino si My Pedia Network, let me tell you a little bit more about them. My Pedia Network is a group of pediatricians that are scattered all over the metro. So iba-iba yung kanilang places. Now, they offer teleconsultations, and sometimes they also offer services for you guys. You just need to go to My Pedia Network and check out kung ano yung pwedeng gawin. But what I love is the fact that these pediatricians, they really came together in order to have this service for all of the parents. So all you need to do, it's a one-stop place. Go there and DM them and inquire, and you're gonna get matched to a pediatrician that is closest to you. Diba nakakakampante? Sometimes kasi, especially ngayon, diba, everything is online, so you're consulting as well. Sometimes, the person you're consulting with is in a far away place, so hindi rin niya alam yung situation sa area or sa city mo. Maganda yung fact that in My Pedia Network, you are actually getting, as much as possible, a pedia who is close to you, who understands what's happening in your area, ano yung guidelines, and if anything happens, maybe can help you out as well. So, alright. So, let us begin. Of course, before we go into our major topic today, pag-usapan natin the fact that right now, aside from having this Omicron variant, ano pang medyo laganap ngayon, nag-change ng panahon, and sometimes malamig, sometimes mainit. So it's also a time where we get a lot of this parang flu-like symptoms. Nakakalito talaga, no, hindi mo alam what could it be. Tatanungin natin mamaya. But if you encounter any types of like flu-like symptoms for your little ones, then we have something for you guys as well, and that is our Stuffy nose collection. Yan. So if you're not aware, let me talk to you guys a little bit more about this. Of course, nagsimula siya dito sa ating Stuffy nose chest rub massage oil. So it's made with eucalyptus, very minty kind of scent. I love it so much. So saan to i-apply? You take a few drops of the oil, you rub it between your palms to release that wonderful eucalyptus scent and really activate it. And of course, make sure the oil is warm. We don't like cold oil on our skin, diba? Ayaw din yan ni baby. And then take that oil in your hands pag na-rub na natin, and hagod lang dito sa chest area. You can place it on your fingertips and do this parang nagki-keyboard, parang nagta-type ng keyboard. This helps also release or declog the mucus a little bit, and in generally helps your baby breathe a little bit easier. Now, with the Stuffy nose chest rub massage oil, meron din tayong stick-ons for those who don't like massages, who don't have time, or want something that is easy to do and can last them a long time. You can take the stick-ons. They are also made with eucalyptus. It also contains a bit of lavender para pwede rin siyang pampa-calm and pampa-sleep konti. So, it comes in 12 stick-ons. You just stick it on the shirt as long as it's near the nose. And again, that eucalyptus scent, that lavender scent calms down baby, also helps them kind of like clear the nasal passages just a little bit. Reminder guys, we're not selling any medicines here, so these are all natural based ingredients that you can use for your little ones, for your tiny worries at home. Finally, we have the Oh No Soothing Gel. So for those who are a bit curious, ano ba tong Oh No Soothing Gel? Para siya dito sa area na to. Diba? Kapag may sipon si baby, pinapa-blow natin ng nose. Blow, blow, blow. So sobrang daming pag-blow ng nose. Sometimes, medyo sumasakit tuloy dito, na-rub masyado sa namumula, nagkakaroon ng paminsan, nagkakasugat sa sobrang pag-blow, basa pa kasi may mucus, tapos binablow pa natin ng nose. So the Oh Nose Soothing Gel, you just apply it. Ayan. So, apply lang natin siya on this part. And that will help as well reduce that friction, reduce that redness para hindi siya masyadong na-rub yung part na yon. So, these are all things that you can have to help you and your little ones when it comes to these like flu-like stuffy nose symptoms at home. So I hope that helps. Now, without further ado, I know you guys are very excited. I am also very excited. And again, as I mentioned earlier, we are so grateful and so lucky to be able to put this together because if you guys didn't know, our pediatricians are so booked right now. Booked talaga sila. They are so busy from morning. Sometimes naririnig ko yung mga pediatrician hanggang gabi may consultation sila dahil napakaraming cases ng Omicron symptoms for children. So we are so lucky to have her here today. Our special guest, she is a graduate of the College of Nursing, and then she had her Doctor of Medicine in UST, both of those, UST. She had a residency training in Makati Medical Center. She's a diplomate of the Philippine Pediatric Society and one of the wonderful, super friendly, super amazing doctors of My Pedia Network. Without further ado, let us welcome Dr. Tricia. Ayan.
Hello! Good morning, good afternoon, Lorraine, good afternoon, Tiny Pods, and to everyone who's watching us today. Welcome to our Facebook Live on, and let's discuss today about Omicron and how it has affected our children.
Thank you again, Doctora, so much for taking the time out of your busy schedule to come and talk to all the parents watching today. And I'm sure sobrang magiging useful ang information na matututunan natin today in this live stream.
Yes, I hope we can we get to help a lot of our parents who are worried, and who haven't yet. Hopefully, a lot still are not getting sick. A lot have gotten sick already in the past month, and so that's why we're here today to help everyone watching today. Hopefully, we get more people to watch us today so that we can spread more information about the COVID, the current updates as well, the current information we have, the updates about COVID-19, and maybe about vaccinations. We can talk about it also later on.
Yes, so tama si Doktora, kaya please like, and share. Now, what we've done, everybody, is we've prepared a few questions already for Doktora, so we're gonna go through them, and if we have time later, we can open the floor to questions from the comment section as well. So hopefully we'll have time. Let's jump right into it, Doktora. So first question, very important for us to define the problem, diba? What is the Omicron variant and how is it different from all the other variants that we've encountered in the past?
Yes, so basically, Omicron is really one of the most recent variants of concern of the coronavirus 2019 that has plagued us for the past almost 2 years already, that we've been in quarantine, we've been handling this pandemic. And it has affected everyone worldwide already. And even before it came here to the Philippines, late 2021 to up to now, it has already spread in other countries first, and comparing it to the first variants that came out that we've encountered, like the Alpha, the Delta, etc., Omicron tends to spread more quickly. So, ibig sabihin, mas nakakahawa siya. And with the cases, we've been counting and all that, we've seen that it has been affecting more kids lately. No, we are seeing more hospitalizations in the pediatric age group, and this may be because of a lot of factors. Also, first, maybe it's really the variant itself being mas nakakahawa than the other variants. Second, being the kids still being included in the vulnerable groups. They are still unvaccinated compared to our adults, no? And of course, there's the relaxing of the protocols, especially during the holidays. We were so excited to see each other, after being restricted for almost 2 years already. But still, it is still COVID-19. It still presents as a spectrum from asymptomatic, meaning no symptoms, but still positive with the virus, to having mild illness, to even severe COVID-19 leading to hospitalizations. And the good news is now that we're in 2 years already. The good news is we know more about COVID-19. We know how to prepare for it and manage it if it does enter our homes.
Ayan. So it is, I think, one of the things that I love what Dr. said is it's still COVID-19. So parang if you are hearing things like, it's mild, it's whatever it is, it's still the same thing. So we still have to keep our guard up. No? So, Doctora, our next question is, now we know what it is and parang how it's slightly different but still a concern. So, the second question is, how do we prepare ourselves before it even, sana naman hindi, diba? But before it even enters the home, how do we prepare ourselves? And of course, our children as well.
Yes, so syempre, di ba, sa laban, very important to know your opponent first and foremost. We have to be informed, we have to be updated, via verified networks. Talk to your professionals, consult your doctors, your pediatricians, no? And don't listen to fake news kasi madaling ma-pull away from fake news. Madaling ma-convince or ma-confuse with fake news going around, no? Very, very important. Second, since it is still COVID, like we said, no, the mode of transmission being still the same, nakakahawa siya through droplets, through airborne din, di ba? So, effective pa rin po yung pag-observe natin ng minimum safety and protective protocols by wearing your mask, limiting movement for essential needs only, and staying at home if with symptoms or you have known exposure already in the past few days. Avoid unnecessary contacts with other people. Again, limit movement to essential needs only. So another thing to prepare is also your essentials. Essentials being your medical essentials. Now, since we are tackling an illness, prepare your thermometers, your weighing scale for your kids, your fluids, especially maintenance medications if you are on maintenance. Like yung mga anak natin who has asthma, who has these allergic disorders or any other chronic diseases that need maintenance medications, make sure that you have stocks of your meds. List of contact numbers, especially of the ER, the ambulance, or any other emergency medical services. Your pediatricians, or your family doctors, make sure that you are in contact with them. And also specifying or zeroing in on COVID-19, it's better to have a COVID care plan prepared. Anticipation is key, Lorene. So, for example, you're at home, you haven't been affected yet of COVID-19. What to do? Hindi naman pwedeng, that COVID is outside your doors at any time it can enter. So, what will you do if it does enter? No? So, in case the whole household needs to quarantine bigla, you got exposed, who will be in charge of what? Who's going to take care of the baby? How to get food? How to get medicines and other essential needs? Where to get funds? Speaking of funds, it's a good time to review your budget, rethink your medical or emergency funds if they are enough. Talk to friends and family that you trust, and learn from other families and friends of their experiences when they had COVID. Learn what did they do, what problems they encountered, and how you can face it if it was your turn already to get it. I mean, let's hope, diba, that you don't get it, but it's very important to be prepared. And also lastly, let's not be complacent. Always, let's change the mindset na, it's just flu, it's just allergies, it's the season, ganyan. Let's not be complacent, no? At the same time, don't panic as well. So we have to increase our assumption of risk that it can be COVID talaga, no? We don't want to take for granted any small symptom, like it's just fever, it's just colds, ganyan, or it's just cough, that you may feel and associate it with other illnesses like flu, allergies, etc. Because the risk of COVID is really there, and it is always there as of the moment, no? So make sure that if you do feel the symptoms, very, very important to quarantine or isolate ASAP. Wear mask immediately, lock yourself in the room already. Inform the household if you got exposed outside, like an adult is working, going to the office, someone tested positive, go home, isolate, inform the household that you need to quarantine, and have yourself tested at the proper time. We want to protect still the vulnerable group, the unvaccinated kids, the adults with comorbidities, and we need to do the isolation very, very carefully, so we don't want to spread the infection. And of course, we don't want to wait for illness before seeing the doctor, especially our kids, especially the babies. We want to still bring them for child checkups to their pediatricians and update their vaccines, no, especially flu vaccines coming up, pneumococcal, their booster shots, etc. So we want to keep those updated.
Ayan. I love Doctor's answer on this. Diba guys, very holistic. Hindi lang siya parang list of stuff. It's also list of things you and your partner or whoever are the heads of the household need to talk about. So yun na ang topic nyo tonight. Okay guys? Pag-usapan nyo na. Yeah, correct, Doktora. It's not
not only a medical problem anymore. It's social, it's emotional, it's financial, and it's a mental dilemma already at this time, because we've been facing it for 2 years, and it has affected our other factors of our life, not just health. So we have to treat it and see it holistically, like you said.
Tama. And again, guys, it is still the best thing to be prepared, so that sana naman hindi, but if it happens, you don't also super panic about it. Like, you have a plan in place, at least you know who to call, which doctor to call. You have a number already there. Okay, so let's keep going, Doktora. Ang dami talaga nating information for you guys. So next question. All right, let's pop it up. Ayan. So what do we do nga? What should the parents do if the kids, or at least one of the kids, gets sick?
Yes, with the kids getting sick, no? So ibig sabihin, they develop symptoms already. First and foremost, isolate immediately. I cannot emphasize this, because the reason behind it is we want to contain the infection. Kasi nga, number 1 pa lang, Omicron, mabilis kumalat, nakakahawa. So remember, regardless kung it's just a mild sipon, mild nanghihina, mild cough, ganyan, remember, it's better to think that it's COVID unless proven otherwise. Let's have that mindset already to contain the infection. Next is, of course, you want to consult your pediatrician for diagnosis, testing at the right time, guidance on how to manage the symptoms, how to isolate properly, and signs to watch out for or to monitor, and to when you have to bring the child to the emergency room. Again, testing. Pagdating sa testing, there's a proper time. Hindi yung kunyari, sipon agad. Lahat na ng household na isa swab mo, isang tao lang yung nagkasipon. Ganyan. So, there's a proper timing. para maging, economical, maging practical tayo, no, pagdating sa resources, para we want to catch the virus on the highest yield possible. So if you're going to do RT-PCR, it's best done on the third day of symptoms. First to third day of symptoms, actually, once you have symptoms. But if asymptomatic, ibig sabihin no symptoms yet, have it done at the 5th to 7th day from the last exposure, if you know it. So isolate first and then count the days to schedule a testing already. And of course, syempre symptomatic na si baby, diba? So we want to treat supportively. Again, I wanna inform the people, no, COVID actually, especially the asymptomatic and mild cases, are not emergency cases. I want to emphasize this because we don't want to flood the hospitals. We don't want to flood the ERs immediately, taking away resources from those who really need them the most, because that will lead to healthcare collapse and further, worsening our condition. So we want to treat it supportively. Your pediatricians like My Pedia Network and other platforms are here for you. We are here available for online consultations to guide you how to manage your child's fever, cough, colds, loss of appetite, etc., and other symptoms, that your child may feel, and guide you, how to monitor you day by day and how to get through this COVID-19. Yes.
Ayan. And I think what Doctora said, sobrang important that we all have to take, if we can take anything away, diba, na parang any symptom is a symptom. And not to, diba, kasi there's always that parang, ano lang yan, sipon lang yan, konting sakit ng ulo, napagod lang ako kanina. Parang there's always this trying to disprove na, no, it's probably nothing. And it's best to just take on the more cautious na parang, this might be it, so I would rather isolate. And if it's nothing, they good. But if it's something, at least, diba, na-contain ko siya. Kahit pa paano. Yun. Okay.
So to add din pala, make sure not to self-medicate as much as possible. Remember, COVID-19 is a viral infection. I'm getting patients, taking antibiotics left and right because they thought of, it's what the kapitbahay got and took, and it improved symptoms immediately. Ganyan. So, consult first, and then your doctors, we are here for you to guide you, to recommend, the medications that your children can take to supportive lang tayo. That's usually it's enough, and the symptoms will last for a few days and then they get back to their normal activity already. Yes.
Ako, Doctora, so true, guys. I know there are very many well-meaning people in your family, your friends, who will offer you a lot of different kinds of advice. But it's still best to check with a medical professional. Alright, so let's move on, Doctora. Our next question is, perfect. When and how do we consult our pediatricians?
Yes, pagdating sa consultation, you can consult actually as soon as now. You can contact your pediatrician even when you don't have symptoms yet. If you're confused with what you're reading, you can consult your pediatricians already. Even before your children are not yet sick, you can consult them already. Just schedule an appointment. But especially if you're confused, if you want to be, informed better, ganyan. So, but syempre, most definitely, I would advise you to schedule a consultation with your pediatricians if your children do at first onset of symptoms, even just the mildest, so that whatever confusion you have, whatever unsure or anxiety that you have, we will be able to assist you with it, to properly diagnose, to properly manage, to properly isolate, And how do we consult? Most pediatricians, a lot of pediatricians, especially the young ones, and even the, or regardless of age, not just pediatricians, even general practitioners and our family doctors are available already for online consultations or teleconsultations, and like I said, COVID-19 isn't an emergency, especially the asymptomatic and mild cases. Can manage it at a distance, me being here and my patient being in Malabon, in even Bulacan, and wherever in the Philippines, even abroad, but as much as our country is concerned, you can reach out to your pediatricians online. There are a lot who are online. My Pedia Network is here. Private pages and platforms are here already. And even your HMOs, if you have health insurances, they do offer. Some offer teleconsultations already. And of course, that's for asymptomatic and mild cases. For those who are developing moderate, maybe severe to critical cases already, don't hesitate not to bring to the emergency room. There is, some warning signs that you want to watch out for na, ay, teka, hindi na to pang online, hindi nakakayanin. Parang may karapatan na si baby, please bring baby to the emergency room already para makita siya in person and ma-manage agad.
Ayan. So, I think Dr. touched on a very important topic, which was this new term na natuto natin since 2020, no? Tinatawag nating
Yes.
teleconsultation. So, the next question that we have for Dr. What are exactly teleconsultations? Parang ano ba yung process? And teach us naman ano din yung mga, para diba, productive naman tayo. Hindi yung naghintay tayo for a teleconsultations. Pagdating doon,
Yes.
nothing's gonna happen. So teach us how we can do a successful and an efficient teleconsultation with our doctors.
Yes, so teleconsultation is not actually a new thing, no? It's been going around even before the pandemic. Kahit simpleng texting your doctor, asking concern, especially pediatricians would know this a lot na very worried ang ating mga mommies and daddies. They would be contacting their doctors even in the wee hours of the day, diba? Through call, through chat, through video, etc. That's counted as teleconsultation already, no? So remember, according to the Philippine Pediatric Society, actually published the telemedicine manual, last January 2021, and they defined teleconsultation as a practice of medicine by means of electronic and telecommunication technologies to deliver healthcare at a distance. And remember, practice of medicine siya. So meron lang specific na mga tao who can perform this. And reminder also, telemedicine is a non-emergency service, meaning it should only be limited to mild or asymptomatic to very mild cases, in the premise that they'll be seen then later on or for follow-up in the clinics or in the emergency room, but very definitely non-emergency or non-urgency cases already. It's not for crisis situations. Again, going back to practice of medicine, as it is a practice of medicine, only licensed medical doctors can perform online medical teleconsultation. So make sure po, mommies and daddies, na yung kausap niyo po, whether audio, whether video, or from whatever platform pa yan, ay doktor po. Don't be fooled by impostors. Check their identity, check their CV, their credentials, confirm with websites like the PRC, like what we are showing here, and other reputable contacts if your doctor, if the one you're talking to is legit, diba? And also, that's the first thing, before the consultation, what else to prepare for? Syempre, before checking, especially for our children, being teleconsult using technology, you need certain, certain gadgets. Like first, it's technology driven, so you need stable internet connection or mobile networks. You need communication device, definitely your cell phones, laptops, tablets, etc. Speakers or microphones, the app or the platform. Some do it via, telecommunication apps, different platforms that has embedded these messenger or conference calls capability, where the consultation will be conducted. Syempre, prepare your environment. It should be secure, quiet, there's no interruption, private, well-lit room with the parent and the child. Syempre, kasi there has to be an adult in the room to communicate what happened, diba? And of course, your medical devices. So, including here the thermometer, the weighing scale is important for the pediatric population because we compute the medications by weight of the child. Your pulse oximeter, so this is a device that measures the oxygen saturation, that's very important. Your tape measure to measure the height of the child, maybe flashlight or your phone light, to check or to take photos of important like rashes, etc. And also your medical records, your baby book, your vaccine records, etc. that we may review during consultation. So those are the things that you have to prepare so that once you enter the room or once your appointment has started, the flow will be seamless, dire-diretso na, you'll have introductions, you'll have review, your consent will be acquired, of course, definitely. And then you will proceed with the consultation much like how you do it in the clinic face-to-face. But syempre, keep in mind that teleconsultation has its limits. We cannot do physical exam, so we will be limited to inspection via video, via photos, etc. So do take that thought in mind that it can be limited and it cannot really, be a kapalit or be kapalit of the face-to-face consult that you can get from your clinic. So if in doubt or you feel like even after consultation, I always say this to my patient, if you think, mommy, that after consultation your child is worsening and he might need a follow-up face-to-face already, please do trust your gut, follow up in the emergency room or the clinic already. I don't mind that at all because we, of course, medicine, we do it hand in hand with our parents. Yeah.
Alright, so I hope you guys were able to get a run through and napaka-important. It helps our pedias get a better assessment and also to diagnose your child's case faster if you have all of those requirements as much as possible, syempre, di ba? Case to case naman yan.
Yes.
Pero at least, diba, you guys can now start, okay, pag magkoconsult ako, hindi lang parang bukas lang ng camera, but you should have these things ready para less time, mas mabilis, and accurate ang maibibigay na reseta or kung ano man na advice from your doctors. Now, Dr. Tricia, you mentioned earlier na there are some cases na hindi kaya ng teleconsultation. So, our next question is, yung sabi nga ni Doktora, when do we have to bring them to the ER? What are the danger signs na, okay, hindi na to pwede teleconsultation, i-rush ko na siya?
Yes, so these are the danger signs or warning signs. Yun nga, like you said, hindi na enough on teleconsult. So bring them na to the ER is our option already for these cases. So first, if kunyari, our child develops fever with other symptoms like difficulty of breathing, fever itself is not really an emergency, we can manage it at home. But if it comes with other severe symptoms like difficulty of breathing, ibig sabihin yung lumalaki na yung butas ng ilong, lubog na yung, kita na yung ribs, no? And then umaalon na yung tiyan ni baby, tas parang aantok-antok, hingal. They're assuming this tripod position, like they cannot play, they cannot eat because they're having difficulty already, they cannot speak. So those are signs na parang hirap na hirap sila. Even without a pulse oximeter, you might guess na ay parang kinakapos siya sa hinga. Bring them na to the emergency room. Second, of course, is seizure without known diagnosis or they don't have their emergency meds at home, etc. If it's the first, especially if it's the first episode, kanyan, bring them na to the emergency room to get help, no? Next is if there's persistent fever, like first persistent fever meaning like 3-5 days na panay-panay pa rin, tuloy-tuloy pa rin. It's good na makita sila, but at the same time, baka we need to do some workup, do some blood tests, examine further what we may be missing something, and hindi na siya simpleng, a viral infection that can easily be managed at home. He might be benefit more staying in the hospital. If the child develops signs of dehydration already, aantok-antok, lubog na yung mata, dry na yung lips, wala nang wiwi kasi nga hindi na sila hydrated enough, so they're keeping their fluids in, no? So those are signs of dehydration already. Ibig sabihin, kinukulang na o hindi na natin kayang painumin sa bahay. Let's bring them na to the emergency room. And of course, the worsening symptoms, no? So initially, cough, colds lang, tapos biglang ngayon, bakit parang mas matamlay na, the meds are not working. We've been through different meds na you follow up already and you were advised already to bring the child to emergency room. Let's listen and maybe, bring the child for consult face-to-face already, to do a full physical exam, get a better picture of what's happening to our children.
I would also like to add, Doctora, a advice or a tip that I got na I think the ERs now, each hospital or each ER has their own protocol. So it's always best, mga mommies and parents watching, to please check with the nearest ER. Ano ba yung protocol nila as early as now? So if in case you will need to do that, you are not stressing out on the day. Parang, dito pala yung entrance, hindi na pala dito. Tapos pagdating nyo dun, hilo-hilo tayo, diba? So check your ERs, call them, or check even, I'm sure they already post that online if they have social media accounts or websites. It's good to follow the protocol. So
yes.
Yan. So next
Tapos,
question.
Also pala to add lang, Lorraine, about the emergency rooms, kasi a lot of moms are scared to bring their children to emergency rooms.
That's true.
And even though, kasi they're scared of COVID, their kids might get it in the emergency room. I would just like to remind everyone that the ER actually does triaging, meaning they separate COVID cases from non-COVID cases. So like, for example, your child got a dog bite, or an animal scratch, ganyan, and he would need an emergency anti-rabies shots. As long as he doesn't have signs of COVID and there's no, sign that he could have gotten COVID in the past few days, they will be triaged separately, and the risk of COVID is very controlled in the emergency room.
Ayan. So don't worry, mga mommies. Pagdating doon, syempre that's number one priority din ng ating hospitals is hindi rin kayo mahawa. So
yes,
kampante lang tayo dyan. Okay, so our next question, Doctora. Ayan, can we check it out? Okay, so let's say ngayon, let's say hindi naman kailangan ng ER. Thankfully, kaya lang nag-positive nga si babies or si children dito sa bahay. How long should the kids be isolated, Doctora?
Yes, so based on the current guidelines, really, especially for kids who have asymptomatic to mild COVID-19 infection, they are really advised to home quarantine, at least 10 to 14 days, why is this? Because they are part of the unvaccinated population. They're still, only as of today, diba, adolescent up pala yung we've vaccinated already. They are still part of the vulnerable group, and at the same time, they don't really have, agenda to go outside. They are not the ones, going to the groceries. They're not the ones going to the banks. Your child, your toddler doesn't need, wag na muna sila nene, sina kuya ang utusan bumili ng toyo sa kanto, ganyan. Let's keep them inside. I would suggest, I do recommend my patients to stay at home, to complete the isolation for 14 days. This will allow them to recover, and be monitored and really get back their energy before they got the infection.
Ayan. So, please follow, guys, kahit marami tayong naririnig all over.
Yes.
So, as per Doctora, 14 para safe na safe.
For me, yes. The safest is still 14 completed. Kasi hindi naman sila yung essential, they don't go to work. Usually, their essential travel would be to the clinic, That's it. Oh, speaking of isolation, like say for example in house, kunyari si daddy or si yaya nagkaroon ng COVID. Minsan, some families, what they would do, papadala si baby kay lolo, lola sa kapitbahay or sa kabilang bahay.
Yes.
Let's not do that. Let's stop doing that. Unang-una, sinasabi ko na sa inyo. Why is that? It's because, again, ano ba ang objective natin? Bakit tayo nag-isolate? It's because we want to contain the infection in the household lang. If lumabas si baby or si mommy, ganyan, alam mo nang merong case sa loob ng bahay, huwag na natin tanggalin yung isang tao na posibleng na-expose, posibleng nag-i-incubate na yung virus, meaning, and then transfer to another household kung saan pwede niya ikalat din yung virus later on. So, ang nagkakataon, hindi lang limited sa isang household, lumilipat sa pamilya, extended family na din yung nahahawa. So, really, I really want to emphasize that if one person in the household, if the household has already been compromised, stay inside, everyone stay inside and observe for symptoms. We do want to limit the infection, syempre. Pero si positive or si symptomatic person, we can keep in a room, and then the rest quarantine in separate rooms perhaps as much as possible and still wear your mask. That's how you properly isolate.
Doctora, I have a follow-up question to that. Let's say one of the parents was positive and then a few days later, biglang nagka-positive na rin yung one of the children. Should they quarantine together in the same room, yung dalawang positive?
Kasi hindi natin maaano talaga, hindi talaga, there's really a high risk na magkakahawaan inside one household. And unfortunately, syempre not everyone is blessed with mansions, and even big houses where family members would have one room each, So, for example, you live in a condominium, you live in a 2-bedroom apartment, etc. Ganyan. We have to do what's best. We have to maximize what we have, maybe assign a COVID ward at home. These are stuff that we can prepare before. Isama na natin yan sa list to prepare. Anong gagawin? Ano yung magiging setup if isa sa atin magkaroon ng sakit? Alin yung i-assign natin maging COVID ward? Syempre, ito yung kwarto usually na merong sariling CR, merong good ventilation, ganyan, So, we have to maximize. And syempre, kunyari, like your scenario, si daddy nag-positive and then later on nahawa na si yung bata. I think I would do it if it was my own household. I would keep them in one room. So, and then the rest still wearing mask, protecting themselves. It doesn't, kumbaga, wala naman na rin mawawala kung magmamask ka for the rest of the isolation. Even if you're together, we are, as long as we have that mask, we have that extra barrier to protect us from, getting the virus and causing the infection. So, yeah, I would, if kunyari 1 bedroom lang, di ba? So, yeah, pagsama-samahin and then next negative. So, as long as nasa isang household, huwag na yung, unless, syempre, kunyari, condo, you own 2 units, sige, di ba? Why not? Pero, who has that luxury? Di ba? We have to be very practical at times.
Definitely. And I super agree with Doctora, like wearing the mask at home, especially when you have a confirmed exposure. It's really
effective, It is effective. I've seen it in my patients, only one patient getting positive, the rest testing negative. Even on retest, even after we checked, the rest of the household didn't get it. Kasi nga, they were able to follow protocols, they were able to do isolation very effectively, and it pays, it's just a few days, it's a couple of weeks of sacrifice. Mas hassle kasi if you get sick talaga. So, that's it.
True. And of course, one of the pinaka-important, don't eat together kasi yan na, 'di ba? Nag-mask the whole day pero kumain together.
It's a break in the isolation. It's a break in the isolation protocol. So, yeah, we don't advise that. We don't recommend that.
Okay. So, with regards naman, Doktora, sa the question on a lot of people's minds right now, no? So, next question is, should we have our children vaccinated, Doktora?
The answer is yes. Yes. Why? First, we've seen the COVID is still there. No, it's still here to stay, and we're hoping it's the end already. There's no variant coming after Omicron, but there's no assurance of that yet. Second is because we've seen the effectivity of the vaccines. Comparing now January 22 to 2 years before, where we don't have vaccines yet, the vaccine, most of the population hasn't been vaccinated yet. There has been a decrease in the rate of hospitalization in general, rate of deaths, and this has really impacted greatly. This has really been impacted by vaccination rates talaga. And we do want to emphasize kasi even the countries, those who first got the variants, even in news, etc., the countries who have low vaccination rates, they were the ones who got the new variants immediately. So really, we've seen the effectivity of the vaccines, and it's not just for COVID-19. We've seen its effectivity in different illnesses. We've eradicated some illnesses already because of vaccines. So why not? And of course, if the parents are worried for safety and all that, remember that the vaccines, before they are administered, before they are distributed to our patients, our children, they have underwent very, very rigorous studies. They were they were developed by very prestigious scientists in companies in the Western countries, and they have they have been approved by the FDA for emergency use. So even before they are distributed and administered, they were already approved. So yes, I would suggest that we have our children vaccinated.
And of course, Doktora, also so timely, guys, kasi Doktora, next question, what is the update on the COVID-19 vaccination guidelines for children?
Yeah, so we did get good news, this week. Even weeks before, we've already been receiving good news already of the vaccine being approved. It started in the Western countries where the children are already getting vaccinated. And the good news this week we received is that we are starting to vaccinate children of ages 5 to 11 years old starting February 4, 2022. This was announced by the DOH, and soon, and the guidelines, us healthcare workers are being briefed on the guidelines, on the specific guidelines on the administration and implementation of the vaccine program. So I think it will be a phased, by phase siya na administration. It's starting with NCR first, since we have the most cases, and and then that's it. And based on the vaccine and on the updates, as of now, only the Pfizer vaccine has been granted emergency use authorization by the FDA for that age group. And according to the CDC, the dose is half or just a fraction of the adult dose that we usually give. So, and it's the same, we as how we have vaccinated the adults and then the adolescents before. The guidelines would still be similar, definitely. If you wish to consult your pediatricians first, feel free to schedule a consult with your pediatricians. For those with comorbidities or possible allergies, or anything, I would advise that you consult your pediatrician so that you'll be guided, maybe provided medical certificates ahead, so that if you have questions, we may answer them. specifically kasi syempre it's a case-to-case basis. Different moms, different parents have different concerns regarding vaccination. So we do want to advise you individually. And that's it. And it's a waiting game. And I think some LGU, some local government units have already started enlisting, the children. I think some schools already are asking to enlist their students as well for the vaccination drive. So if you do have a 5 to 11 years old, I would highly recommend that you enlist your child. If you do have concerns, if you have questions to consult, feel free to message us at My Pedia Network or your pediatrician in their private pages, etc. If to ask more about the vaccine, maybe ask for certificates, that they can be allowed if they need emergency medications, etc. Yeah, go ahead. Why not?
Ayan. And I love what Doctora said na actually they have been preparing for this already. So for all the parents who are watching, if you think parang, ay biglaan, nag-start lang sila out of nowhere, kakarating lang, tas automatic. It's not, di ba?
No.
As per Doctora, they have been getting retraining and their own preparation to roll this out in a safe way for the children. So
Yes.
don't be worried, guys. Ayan. So, Doctora, thank you so much. And sobrang timely kasi kakalabas lang talaga ng balitang ito. And I'm so happy that it has finally started here in our country because it's been starting in other countries as well. So, Doctora, what are some of your advices to those parents watching? And of course, maybe you can tell us more about My Pedia Network as well.
Yes, again, Laureen has already introduced us very, very well at the start of the program. Again, My Pedia Network, we are a group of great pediatricians, who are very reachable, very approachable. You can easily reach any of us online. We do offer teleconsultations, clinic consultations, and even home visits, for the well children. And we are scattered. Currently, we are 9 pediatricians, even growing. We plan to grow our family. And we strategically, planned it out so that anyone around the National Capital Region would have a near pediatrician or My Pedia partner easily reachable for them. So yes, do check us out. We have our social pages at My Pedia Network on Facebook and Instagram, and we do our next content would actually be about teleconsultation. So you do wait for that so that you can be guided on how to do the teleconsultation, how to prepare for it, and what to do after actually even. So yes, that's it. Thank you so much, Lorraine.
Thank you, Doctora Tricia. Let's give her your hearts. Click your heart buttons down below. Ayan. Thank you so much, Doctora Tricia. Okay, from My Pedia Network. All right. So for all the mommies watching, I hope, and daddies, of course, I hope this was able to help you guys out. You can rewatch this live anytime after we air it. You can go to the part kung ano yung question ninyo. Nakasulat naman yung questions down below. So pwede nyo skip, hanapin nyo kung ano yung question ninyo. And of course, kung meron kayong question na hindi na isagot sa ating live stream today, alam ko maraming own situations, own questions. Please don't forget to message. And even if you can or if you would need to is to book a teleconsultation with My Pedia Network. Sobrang bait, sobrang friendly talaga ng pediatricians and sobrang dali nila kausap. So I know you guys will be in very, very good hands. Now, for those who are also looking forward to, as per Doctora, di ba, kailangan natin mag-stock up on essentials. So for those who are looking forward to stock up on baby essentials, I would also like to let you guys know that meron tayong exciting sale coming up. So you can check out the Lazada Baby Fair happening from Jan 28 to Jan 31. It's a great time for you guys if you need to stock up on your essentials at home, cleaning essentials, skincare essentials, or tiny remedies from tiny buds It's a great chance to be able to get them on sale. Plus, for all the new mommies, you can also get a starter pack for free with minimum $9.99, which includes 3 items, which is of course the bottle wash, the laundry, and the Inner Rash diaper cream. So, ang dami-dami nating freebies. One of the items that I hope you don't miss out when you or if you're planning to grab during that sale is our after shots. Ayan, if you are planning to go for vaccinations or your little ones, you can apply this gel on that spot kung saan naturukan siya, and that will help lessen the discomfort after vaccination. So, check that out during the Lazada Baby Fair, and please comment down below what are some of the topics that you would like us to invite more experts like our doctors from My Pedia Network to tackle next time, so that kung meron kayong questions, meron kayong concerns, diba? We are here with you no matter what you are going through, diba? Tiny Buds will be here growing with you. Again, if you know somebody who needs to learn more about the topic today, who's going through maybe some positive cases at home, please do share this live stream para makatulong din sa kanila. Thank you so much for everybody who stayed with us till the end of the live stream, and stay safe, stay healthy, and I will see you guys in the next one. Bye-bye!